guys, in this lesson, we're going to talk about first-degree AV heart block. It can also be called just first-degree block. We're also going to talk about the characteristics of it, nursing interventions, and treatments. So let's go ahead and get started. So in first-degree AV heart block, the SA node still initiates that impulse, and it sends it down across the atria, so the atria contract, and then down the AV node. Remember that the AV node normally slows down the impulse so that the atria can contract fully. Well, in first-degree AV block, it slows it down too much. So it is taking longer for the signal to get from the atria down to the ventricles. And this is actually measured with the PR interval. Remember that a normal PR interval is from 0.12 to 0.20 seconds. So in first-degree heart block, the PR interval is greater than 0.20 seconds. And that just means that it is taking the electricity longer from the SA node to get to the ventricles because the AV node wants to act up and hold everything up. So let's go ahead and break it down a little further and do the 6-step method. So the first thing I got to do is identify the rhythm. Is it regular or irregular? So from here to here, I know that I have 27 boxes. And so I know that my rhythm is regular. Depending on what my underlying rhythm is, this could be regular or irregular. Like if I have a sinus arrhythmia, then it would be an irregular rhythm. Okay, so in step number 2, I got to count the heart rate. So 1, 2, 3, 4, 5. So 50, but let's do the 1500 method. So 1500 divided by 27. And I get 55 beats per minute because that method is more accurate. Now in step number 3, I got to look at the P to QRS ratio. Do I have one P wave followed by one QRS? And I do. Every P wave on this is followed by a QRS. So my P to QRS ratio is 1:1. In step number 4, I got to do the PR interval. So I'm going to go ahead and count here. So from here to here, I have 1, 2, 3, 4, 5, 6 boxes. So that gives me 0.24 seconds. In step number 5, I got to look at the QRS complex. So I'm going to go ahead and do this one. So from here to here, I have about a box and a half. So 0.06 seconds. And in step number 6, I identify the rhythm. So I actually have sinus bradycardia with first-degree AV heart block. Now, if my rhythm was to be regular, then I would have sinus rhythm with first-degree AV heart block. These are all the characteristics of a sinus bradycardia, and so you always just got to know your underlying rhythm. So let's go ahead and recap a little bit about the characteristics of first-degree AV block. The rhythm can be regular or irregular, just depends on the underlying rhythm. The heart rate, again, depends on the underlying rhythm, but because there is an AV block, things are being slowed down. It's usually a slower rate. P to QRS ratio will be 1:1. The PR interval, this is the important one here, will be greater than 0.20 seconds. QRS complex is usually normal, and you got to know the underlying rhythm. So this is a relatively harmless rhythm unless the patient is really bradycardic and symptomatic. So let's go ahead and talk about signs and symptoms and how to manage it. So again, the clinical presentations, people are usually asymptomatic with like a sinus rhythm with first-degree AV heart block. They become symptomatic when they are bradycardic. So nursing interventions are continue to monitor them as long as they are asymptomatic. If you can determine and treat possible causes, usually again, they can be some electrolyte imbalance, or it can be medications that slow down the AV node conduction, or it can be something more serious like an MI. So always try to find out the cause and treat the cause. And again, if they are symptomatic and they're bradycardic and symptomatic, then we just follow the ACLS guidelines. If they are usually asymptomatic, like most people are, then you just continue to monitor them. So the key points that you need to remember from this lesson regarding first-degree AV heart block is to just remember that the AV node is slowing the impulse. So it takes longer for the impulse to get from the atria down to the ventricles. And because of that, the PR interval is greater than 0.20 seconds. Nursing interventions, continue to monitor them. For the most part, it is okay. Unless they have a symptomatic bradycardia, then you follow the ACLS guidelines. If you can, identify and treat the cause to try to improve their first-degree AV heart block. So I hope this little lesson makes it easier to understand first-degree heart block, and make sure that you guys check out all of the resources that are attached to this lesson, and make sure that you guys go out and be your best selves today. And as always, happy nursing.